Thank you very much and welcome to another episode of the Health Quest by Betty. Today we will be talking about thyroid disorders. Have you always wondered what that is all about? Don't worry. In studio, we have our guest today who is going to take us through all the questions that you've asked in the previous episodes, and hopefully we are going to be experts by the end of this. So Daktari, we have been thinking so hard and wondering what thyroid is all about, wondering if all of us can actually get that disease, how to avoid it, and all that. But I know you're an expert. You have been very good at discussing this. So please tell our audience who you are, what you do, and probably where they can find you at.
Thank you, Betty. I'm so honored to be a guest in this program and this podcast, and congratulations for beginning this podcast. My name is Dr. Wairagu. I'm a consultant physician and endocrinologist. I know some of you are wondering who is an endocrinologist.
Yes, we're actually wondering what
even
endocrinologists do.
Physician.
Yes. You could elaborate that.
Yeah, so as a physician, I deal with adults with medical conditions. So I don't deal with pediatrics or people who need surgery. So for a physician, basically is a consultant who is specialized in internal medicine, basically all medical conditions in adults. But after that, I've already subspecialized. I'm an endocrinologist. So in this, I deal with the diseases that affect glands of your body. But now that raises another question. What is a gland?
What is a gland?
My
Yes.
goodness.
What is it?
Yeah, a gland. When you say endocrinologist and you're saying I'm specialized in glands, glands is a body part of a body organ, whose work is to produce hormones.
Okay.
Now another explanation. What
So
are hormones?
we're back to hormones. We must be really complicated creatures, right?
Yeah, so now again you talk hormones. These are chemical substances which are produced by these glands, and they're released in the bloodstream, and they control your body functions.
Okay.
Yeah.
So what we are, who we are, is actually controlled by hormones.
It's controlled by hormones. How your mood is, how fast your body, when you eat your food, how fast the food is broken down. Is hormones which control that. How fast your heart rate is beating, that is a hormone function. And the thyroid gland is one of these glands that now controls that body.
Wow, that is quite intensive, and that is very useful for our audience, I am sure. So what exactly is a thyroid, and is it an important organ in our body? How important is it?
Yeah, so thank you for that question, because the thyroid gland, as I said, is one of the many glands in the body. You have many glands. But today we'll focus on the thyroid gland. Maybe another day you can invite me or one of my colleagues to discuss about the other glands. Okay, so a thyroid gland is that organ now which is, where it's located, it's the front part of your neck. You see where the men have their Adam's apple here?
Somewhere
so
here?
just below there, that's where the thyroid gland is. So on a normal size of a thyroid gland, you're not able to see it. So when I can't see your thyroid gland because it's when the normal size is there, so it's not physically visible. But when you do ultrasound, you're able to pick it on imaging. Okay. But when you have one of the conditions which is called goiter, which I think I'm going to discuss later, it can become big, and now it can become obviously it can be seen. So that gland, where I've said, is located at the front of part of your neck, and it's shaped like a butterfly. You know a butterfly?
Yes.
Wow.
So those like love.
Yeah. So you see, the butterfly has the two wings and the body part. So there are two sides: the right side, the left side, then the middle thin part. So you have the left. So the two sides are called lobes.
Okay.
So it have two lobes, the right lobe and the left lobe. So the thin inner part which now connects the two lobes is called the isthmus. Yes. So those are the three parts of the thyroid gland.
And how important is it?
Wow. As I said, it's a gland that produces hormones that controls many body functions, which I said, like issues about metabolism, how you break up your food, the cardiovascular, there's the issue about to do with the heart, how fast. So those are now, the thyroid gland now produces those hormones, and maybe I mentioned the names of those hormones. We have two main hormones which are produced, but there's a third one I'm going to talk about. But most for the disease of the thyroid gland, we talk about the T3 and T4. Okay, so that the two hormones. Okay, but now there's another hormone which is also produced in the thyroid gland. It's called the calcitonin hormone. So this one controls the calcium metabolism. So you have, and there's some specific cells that produces it. So you see that's now those are the different functions of it. But now for it to work, it's controlled by another gland. So it's very interesting how intricate how our body functions. I think when God was making us, He really sat down and thought.
So it's actually a web
of
hormones relating with each
other.
other.
So this part controls this controls this. Yeah, it's a cascade of events. Okay.
Let me take you back a bit. You spoke about T3 and T4, and I know they have difficult names. That's why we do not want to go into the names. However, there are patients who will come to you and ask you, I've been asked to do a thyroid function test. What is it that is being looked out for, and what should worry them?
Okay.
Yes.
So as I said, the thyroid gland is controlled by another gland, which is called the pituitary gland.
Okay.
So the front part of the pituitary gland produces a hormone called TSH.
By the way, where is the pituitary gland?
Pituitary gland is inside your brain. For those who are new to this, we did biology. You had the hypothalamus. There's that pituitary fossa there, just inside. So there's a small gland which is there.
I think by the end of this, all of us will be biologists or doctors.
So that thyroid, pituitary gland produces another specific hormone called thyroid stimulating hormone, which is abbreviated as TSH. So I think for the purpose of here, just understand this as TSH.
Yes.
So this gland now, again, is controlled by another gland in the hypothalamus, the TRH. So this controls, this controls, this controls, this controls this, yeah? So once the TSH is produced, the message is sent to the thyroid gland. So it's now released to the blood and goes to the thyroid gland. And what does it do? It informs the thyroid gland to produce or to synthesize the thyroid hormones, the T3 and the T4. So they work together. So when you're saying about the thyroid function test, we have to test the three hormones. We have to test the TSH, even if the TSH is not coming from the thyroid gland, it's coming from the pituitary gland, but it's a main controller. When there's a problem with the thyroid gland, it's going to affect the production of the TSH. When there's a problem with the pituitary gland, it's going to affect the thyroid gland. So that's why when you're told to do the thyroid function test, for most people you have to do the T3, T4, and TSH. But occasionally maybe the doctor may want to know, maybe you're not, obviously you have a thyroid disease. For the screening purpose, we may just do one of the tests, the TSH. So when there's a problem, then you can go ahead and do the T3, T4. So yes, TSH is used for screening for the thyroid disease. Whereas now when you already have a thyroid disease, we may require now the whole profile, the T3, T4, and the TSH.
Do we screen everyone?
Not necessarily, but there are guidelines which the doctor determines. When it says screening of a disease, when you screen is somebody who doesn't have obvious
symptoms,
conditions, okay? But there are some certain people who may come. I know you deal with a lot of obesity, and somebody comes and feeling fatigue. You may want to know, is it part of what is causing this? Then you just do a screening test called TSH. But somebody who is obviously having the symptoms of the thyroid disease, which I think I'm going to mention later, then you may need to do that will be a diagnostic. You're diagnosing a thyroid disease. So you may need to do the three hormones.
Okay, great. And what are the common thyroid disorders that we have? Let's come back home.
Oh, yeah. So you say home Africa,
Kenya,
or Kenya?
Africa, Kenya.
Okay.
Home is home.
Home is home, yeah. There are quite a number of conditions that may affect the thyroid gland. So one, we may have the thyroid gland can be hyperactive. It can produce more hormone, excess hormone, than it's supposed to produce. So the way God made our body is that you're supposed to produce in certain hormones at a certain levels. So there's a range. So everybody produces between this, and depending on whether you are children, they have their ranges, and the adults. So there's a certain studies have been shown this is a normal thyroid hormones levels. So when now produce more than that, that's called now excessive hormone production, which is going to cause now more issues, which I'm going to mention. What is that excess production is going to cause? Then you may have a situation where the thyroid gland is underactive. It is not producing hormones as it's supposed to be.
Yes.
So then now when you do those tests, you find the levels on the lower side. Okay? Then that is called an underactive thyroid. But medically, for us now, because you have to sound, I cannot say, I can't say an underactive for you when I'm explaining, but now for medical, we call that one hypothyroidism.
Okay.
So hypo means less.
Less.
So like, yeah.
So there's hypothyroidism
And hyper is excess.
Excess production.
Where hypo is less.
Less. So
So
less
that the two
production of
main,
the thyroid
yeah.
hormone.
But there's some people who may have a problem with the thyroid and make appear, like, when you have hypothyroidism, sometimes you don't have the enlargement of the thyroid. It could be the normal size, but it's overactive. So it can be enlarged. So you can have an enlarged thyroid gland, which is hyperactive, or an enlarged thyroid gland, which is underactive. Okay? But there's sometimes the normal is the normal size. Okay? But again, there are people who have just enlargement of the thyroid gland, but is producing the normal hormones.
Wait,
so it's just
hold that
enlarged.
Thought there.
Yeah.
Hold that thought there. Does it therefore mean that when I see somebody with an enlarged gland and it's appearing on their neck, it is not necessarily that they either have hypo or hyper?
Yeah, the test have to be done. Could even be normal. So that's why we have. So this, when you have now enlargement of the thyroid gland, that's called now a goiter.
Okay.
So not everybody who has a thyroid disease has a goiter.
And
not all goiters are hyper, or so some of the goiters,
okay.
they are functioning normally, but for whatever reason they have become big. So
thank you for that clarification. I'm just wondering to our audience, did you actually know that, or every time you see somebody with a goiter, you always concluded that they have a thyroid disorder?
Yeah.
Okay, so the two thyroid disorders, as you mentioned, hyper
or
and
hypothyroidism, a goiter now, which
now
is with a normal functioning. Okay.
Okay.
But now for specific disease, because now that's just the general classification. I mean, the general diseases, but now each one of them can be caused by different things.
Yes.
So when you say you have hypothyroidism, so what can cause that? So I'm not a pediatrician, but I'm familiar with some of the pediatric things that. So some children who are born without the thyroid gland.
Okay.
So there's thyroid agenesis. So that's a congenital anomaly. I don't know whether the maker forgot to put or something happened. Some genetic mutation and the thyroid gland was never
missing.
formed.
Yes.
If I go backwards, the thyroid gland start forming by the 3rd or the 4th week.
In pregnancy?
In pregnancy.
Okay.
So by the time that you have your baby inside you, by the time you're 12 weeks in pregnancy, the thyroid gland is already functional because it has to start controlling the child from the word go. So if that child is born without the thyroid, they'll already not be having those hormones. So that's called congenital hypothyroidism, which can be there because maybe the thyroid gland was not there, or there's some mutation of some enzyme and the hormones are not being formed. Okay. But now you can have people who have been removed the thyroid gland. Because we come to the management, part of the management is to remove for surgery, where it can be removed for one reason or the other one. So once surgery has been done, you don't have the thyroid gland, so definitely where are you getting your hormones? You're not going to have those hormones. You're going to have hypothyroidism, and that's why after surgery, you may need now to be given thyroid hormone to replace what your body is not producing. So that is one. There are people who have some conditions, they're called autoimmune diseases, which can affect some enzymes, and your body does not produce the thyroid hormone.
When you say autoimmune, let me just take you back for the sake of the listeners. When you say autoimmune, what do you mean?
So these are very interesting diseases where the body just produces sometimes in medicine it's so hard for him like to say antibodies. What are antibodies?
I understand.
So I can now split. You know what I'm saying? So just I know you can check what is antibody. So
so our listeners, you have an assignment to do. Check what autoimmune and antibodies are.
So those are antibodies, and now the body remove those chemicals which fights its own self. So the antibodies against the cells that produce thyroid gland. So whatever reason, you don't know why it is happening. Sometimes it runs in the family, some genetic. So you find when somebody has a thyroid disease, you have to find out, is there somebody else in the family with the thyroid disease? Because sometimes they have other autoimmune diseases coming together. So you may have that thyroid disease, and then you happen also have like type 1 diabetes, which is, is on autoimmune. So you can have multiple autoimmune diseases which are affecting the production of certain things in the body. So when you have such a situation, that is called the Hashimoto's thyroiditis. So your body is not able to produce the hormones. You get hypothyroidism. Then iodine, I know you're a nutritionist.
Yes.
So what, you're familiar with iodine.
Hello, my name is Betty Okere, a clinical dietitian and diabetes educator. Brookside Plus probiotic yogurt provides you the goodness of good bacteria for a healthy gut and a good immune system. Probiotics are live microorganisms that can be added into our food or into our gut system to help us be able to maintain a healthy balance, thereby promoting good health and supporting our immune system. Brookside probiotic yogurt, you can use it in any form. Add it to your smoothies, drink it off the glass, and you will be able to enhance that healthy digestive system. One thing I remember, and I think I thank the government for, even as I grew up, we were always told to take iodized salts. As a child, I never quite understood why we have to do that. And I know now in the market we have iodized salt, which actually happens to be the cheapest, so that everybody can afford. But we also have other types of salts. But let's hold that thought there. We'll talk about it later. You mentioned something very profound, that sometimes if you have a family history of thyroid disorders, then you're most likely to have the disease. How do we tell? How do we even know who has thyroid disease in the family?
You have to go to the hospital, and the doctor who is maybe has found you already have the thyroid disease, then you can ask you. That should be a question that a good doctor should be able to ask you. And also, maybe I've observed, now that you know where the thyroid gland is, maybe you can go, when you go for family meetings, you'll be peeping.
Peeping and seeing.
So, but let me go back to the iodine. I don't ignore the iodine, because you've talked about the causes of thyroid disease in Africa and in Kenya. So the iodine is a very important, essential nutrient, or those trace elements that are needed in the body in very small amount. But they're very important. When you don't have it, the time you realize how important that element is. Okay, so it's one of the products that's, but the body does not produce its own iodine, so you need to get it from foods and stuff. Okay, so when now before in the early, in the 19,000, before the 2000, there was a lot of endemic goiters, where you find people in a certain locality, they were getting the goiter. So some studies were done and found some of the soils, they don't have enough iodine. So even because some of the foods you eat, you have to have you can get your iodine from the foods you eat. But the types of soil that food has grown determines whether you're going to get enough iodine. So they found it was found that some soils are lacking iodine. And now another time they say they need to do universal salt iodinization. Because salt is happen to be the most cheap, and most people universally add salt in their food. Most ethnic cultural people, when they're eating their food, salt is a very important product. So they found like what's the best way of making like universally everybody is getting, because we don't need it in very big amounts, we just need it in small amounts. So you can put it in something that you're able to eat every day. That means you can get your subsequent, and that's why now the universal ionization of salt was introduced and became universal. I think maybe you can check on this, I don't want to lie, maybe around 1978 is the time, in the early 40s, the time now they were doing these studies. But there's a year, I think, if I'm not sure, 1978, where they became now universal. It was now a requirement. The WHO recommended that all the salts which the manufacturers are doing, they have to put iodine in it. And this one they found those now goiters, the prevalence
was
were able to reduce. So they found that's how it was. And Kenya, you have adopted that. Wow. So salt is very important. So you can imagine people who are told don't eat salt. I know we have some certain condition where you want again to reduce the salt, but that we don't tell the patient to totally remove their salt. And unless you're able now to supplement the iodine. In the salt is, like let's say people with severe heart failure and you find a little salt is worsening. So maybe those one they can use supplementation of the iodine. By removing that salt, some patients may now develop now the iron deficiency leading to hypothyroidism.
And I actually like that point because you realize that sometimes most of us like to use a blanket approach to management of diseases. I know. Somebody is told you have hypertension and they go home and the whole family says no salt. You do not know what else they're missing. So you might be trying so hard to reduce the blood pressure, but in essence you're reducing the iodine and exposing the patient to risk of
so iodine is now thank you. So the iodine now, the importance of it is needed in the thyroid hormone synthesis. So that means when you don't have it, you cannot synthesize. It cannot synthesize. So there's a whole intricate process. So this it cannot be covered. Maybe that one I can present to a medical student. I agree with you. I can go to that level, but not for this audience.
I agree with you. And is that a problem? Is the thyroid disorder and iodine deficiency a problem in Africa?
Yeah, very big problem. It is, despite what we have said, the universal ionization, there's still some culture they're not going to take, or by the deficiency of the soil, of the
iodine in
the soil. So they're eating, let's say even when they eat the dairy, they take the milk in the dairy, because one of the sources could be the dairy products. And some seafood, fish. I know you come from the lake, you don't maybe that's why you are.
And actually, then there's always that debate of is it the sea food and sea fish that contains more iodine, so should we be eating that more? Or then do we eat the lake fish, fresh water? Well, that's a discussion for another day.
It's still a problem. So despite that, remember, I've just covered the hypothyroid. Don't forget, I'm still getting don't lose 2K. So let's move to the opposite. I've just discussed the hypoactive thyroid gland, hypothyroidism, and some of the common causes. Let's go now to the opposite, the hyperactive gland, that gland that's producing a lot of hormones. What can be the problem? So one of it is now another autoimmune condition. We have two autoimmune diseases. One can cause the hormones not to be produced. That's what I call the Hashimoto's thyroiditis. But now we have the opposite, where now another antibodies, autoimmune disease. Now those antibodies, they make the gland to be hyperactive. Now this is called the Graves' disease. Graves sounds so grave.
Like the grave.
Like the grave. So this is now called the Graves' disease. So now the body produces now excess hormones. Remember, we say the function of these hormones. So now, if it's controlling your heart rate beat faster. The other one was causing it to slow down. So if your metabolic, it's increasing your metabolic rate, basal metabolic rate. So you eat food, but your body is being broken very fast. So these are the people who we may find. Somebody tells you, I'm eating excessively, I'm eating a lot, but I'm losing weight. Because the body is now on a drive, okay? You are sweating excessively. Your moods are up not. You become irritable because now your hormones is...
It's working, it's an overdrive.
Oh my goodness, yes. All those things, okay?
You're making me think hard. So the next time somebody is having... let me leave it there.
So it becomes a lot. So now that is an autoimmune called the Graves' disease. But it will have other symptoms. The eyes will start popping out like this. I don't know if you've seen people in the street and you find like their eyes are almost coming out of their socket.
Yeah,
have you seen
it
that?
looks like the eyes are popping out, and you know the eyelids are way at the back.
Sometimes I'm in the mall and I see somebody, I'm like, I hope that person has been checked for their thyroid.
I know, the problem is you cannot walk up to somebody.
So you can just go and
them.
stop. You're like, sometimes you're like, okay, wait, maybe it's not a hospital, but I'm like, that could be thyroid.
You can only pray that they actually get diagnosed.
Yeah,
and be treated.
actually, there's one in church, a young lady. So he's like, "Have you been checked your thyroid?" She's like, "Could it be?" Yes, and she went and she was checked. So at the time when I was young and a bit nosy, I was. No, you are like, you just calm.
There's a problem with working in the medical world. Sometimes you see a problem, but then you have to keep it to yourself.
You have to keep it to yourself because you're like, you cannot go in this. But that particular day, I had to, because you're the young guy, I was like, "Have you been checked your thyroid?" What is that? So I took my time. I give them the contact. Just go and check. Then actually.
But actually, that's useful because that's why we are doing this podcast, so that somebody can hear a symptom or can be able to listen in and whatever is being discussed, they're able to take it up with their physician.
Okay. So back to the hyperthyroidism. Yes. So the people who have now the thyroid gland can be big, but it has nodules. So it's not uniform because here when you touch like this, you feel, hey, there's a swelling here, there's a swelling. So that's called a nodule.
You're making me touch mine.
Oh my God. So it can be a single nodule or it can be multiple. So you can see now. But the ultrasound is going to show. So it can be, it's one of the investigations we're going to talk about. So you can have now that thyroid is now producing now excess hormone. It may be a cancer or not a cancer. So you cannot forget about the thyroid can get cancer. So the thyroid cancer. So you can have that nodule which is benign or non-cancerous or it could be cancerous. So there's a test which it has to be done. It's called the fine needle aspirate. So you aspirate a needle. And I think the time I did a YouTube on FNA.
We look for it.
Yeah, so if you can Google, you can go to my channel, Wairagu, and you check on the thyroid, you may see I've explained that on some YouTube.
Great. Yeah. She's actually telling you that she is a celebrity doctor and she's able to explain this. Yeah. So yes.
So for that FND, I've really, I went, I've demonstrated how it's done. So yes, it can be done. And because some people who have a cancer. So I know when I mention cancer, people now get scared because you're like, that C word is not.
But it's good to know. Yeah. You know, I know most of the times people say what you don't know doesn't kill you, but in the medical world, what you don't know will actually kill you.
Yeah. So the thyroid can get a cancer. So now there are people who have said that the goiter can be big, and sometimes they can be big. There are those one even like 6 meters away, you can see somebody has it. So that comes with an issue because you can imagine how many the organs which are around your neck. You have your trachea. The trachea is what is the breathing?
The breathing system.
The wind with a windpipe.
Can we just leave that to the ENT people?
There's a trachea which is called the windpipe. So it can be compressed. So the thyroid gland can grow outwardly or even inwardly. So inwardly it is going to compress or put pressure on the organs behind it. So some people come because they're feeling I cannot breathe well, or they're having this cough that is not going, or somebody now when they're trying to chew your food, like you like your ugali, so the
ugali can't go down.
So you feel you have to.
It's choking. You have to take in so much energy.
You have to take some water to push it down. So those are called obstruction. So you can have a thyroid which is big, or some they're not even that big, but they're growing inwardly. So they can. So some patients they may come not because they have symptoms of hyper or hypo, but they come with obstruction now. And those ones they may need part of their management. They may need to be done to be removed.
So they might require surgery.
They require surgery. So so those ones are the main one.
Wow. Wow.
Yeah. Yes. We are still talking about Africa and the disease of the thyroid gland. So some patients even have an infection. The thyroid gland can be infected. Sometimes it's a viral infection. So that virus can get a flu and get a thyroid infection. Then your hormones go up. Yeah, some viral infection can. So you find it may for you may present the flu, then later you find you have presented the symptoms of hyperthyroidism. So that virus, maybe it has spread to the thyroid gland, and now you may produce now excess hormones at that particular time. So that would be like an acute kind of a thyroiditis, which now when it comes to the management may need things to suppress the inflammation. So just an inflammation of the thyroid gland, which is making it hyperactive. It's not an autoimmune, it's not, so you're getting that. So the doctor can be able to determine this is thyroiditis, and they do the test for the autoimmunes, they're negative. And then it resolves once the infection is finished. That one can be a temporary thing, okay?
Do you know why I'm getting shocked? And I'm sure even the audience will get shocked on this.
Yeah.
Because again, let's come back to Africa, let's come back to Kenya. Every time somebody has a flu, do you know we never take it seriously? We're just like, you have a flu, so what? You need to come to work, and that shouldn't keep you home. And that shouldn't even take you to hospital. But we learn every day. So yes, the next time you have a flu, just know you need to go check.
So
it can be an infection.
It can be an infection.
All right. So that we talked about hyperthyroidism, hypothyroidism, and when you're mentioning the hyperthyroidism and the goiter, and when you're mentioning the hyperthyroidism, you actually spoke about symptoms, so fatigue, somebody's eating excessively but they're losing weight because metabolism is heightened. How about when we have hypothyroidism? What are some of the symptoms that we can actually look out for?
Yeah, so the hyper, let me expound on the hyper. They're more dramatic because the person is of an overdrive.
Yes.
I've had one case where I always remember this story. A lady comes and tells me, I don't know what's up with me. That when I see my husband, even if I'm cooking, I just went through a sufuria on him because he's irritable.
Whoa.
Makasiriko. For those who understand Kiswahili.
Makasiriko,
ile, but you see,
irritable,
there are people who, I mean, generally sometimes women were irritable, but you realize this, sorry, no. Sometimes it can be, it depends. So now when you find this is not my usual, and sometimes they're even scared of themselves, they're like, I've overreacted.
And you do not know what
and
has
you
caused
don't
you
know.
to
You're like,
overreact.
that is, you can notice this is, so it can mess up with, I've seen family breaking down because of, and because the husband does not understand, why is this, or the spouse or whoever you're, even the children. There's one case, a lady came and told me, I don't know what's up with me. My children no longer call me because every time they call, I quarrel them over the phone. My husband is no longer coming home early because she want to find me asleep because the minute he enters the door, I just quarrel. So irritability. Then they start feeling the heart is beating very fast. And normally when your heart is beating, you're not aware. Are you aware your heart is beating?
Not quite, even right now. Not. I just know I'm alive.
But you've had cases where you feel, let's say you're anxious, or maybe before the exam.
Or if you see a lion.
So those are called palpitations, awareness of your heartbeat. So somebody's like, my heart is beating very fast. Some people have tremors, you're shaking. You're there and you're like, okay. You're shaking, but you hear that?
Yes.
Then excessive sweating, not because there's sun or you, but the body is just, because the body is on overdrive, Then the other things you may have, even your hair may start changing, becomes thin when you have hyperthyroidism, okay? As I said, one of the conditions for the grave disease, your eyes may start popping out. There are people who swell their feet, they become swollen, which is called edema, okay? Then you may find you're going to the washroom more. Hyperdefecation. You poo-poo now, another one, because your body is metabolizing very fast. You get that? For women, it also controls your menstruation.
Okay.
So people with hyperthyroidism may find either you're having some issues with your, so may have menses, you're having excess, or they may disappear. Okay? So that can be one other thing. And we'll be talking about thyroid disease in pregnancy. I'll mention a bit of it, Now that is now the overdrive. Now when you now the opposite, the other thing is heat intolerance. When you go to the sun like this, you cannot tolerate, you just, that's called heat intolerance.
Okay.
You can't go near fire. You feel this is, you're very uncomfortable. Wow. Whereas and before maybe you didn't have this symptom, but now you suddenly feel, I cannot tolerate this heat. For those who cook with open fire, Now imagine a mother not able to go and cook for the family. So they feel, no, it is too much. They're not the opposite. You don't have enough hormone. So think about the same symptoms, what is going to happen the opposite. So your moods, so this one you're hyper, down this one you're
always sulking.
You are sad. You're like, I don't understand myself. You don't have the energy. You don't want to.
You want to sleep.
You just want to sleep. Now here you don't have the appetite, because remember you eat a small food.
Yes.
But it's not being broken down fast, so
You're
you don't feel hungry, and you're adding weight. There's one you say hata ukiangalia chakula hivi. It's one of those instances. So now that your heart is not beating fast, but the doctor can feel is on the low. You can't. It's slowing down. So that when the doctor is examining, tell you, normally, do you know how many times your heart beats in a minute?
Well, maybe you should tell us so that I do not guess.
It's between 60 and 100. But on average, people say 70. That's the average. But no, there's a range between 60 and 100. So in your hyper, your heart rate will be more than 100 beats per minute.
And you are not running.
And you're not running. Okay? Now, when you're hypo, your heart rate chances will be less than 60. That's called bradycardia. You understand? So you may feel that. Then you talk about the mood. Then you're constipated. There you are saying you're overdoing.
So there is
and the cost of tissues.
Hyperdefecation when you have hypothyroidism, but then you actually are constipated when you have hypothyroidism. Interesting.
Yeah, you may also get the legs are swelling, your hair, and again some hair changes that come with you when you also have ID. So the hair in hypo may become a bit hard. Yeah. And a bit, I don't know, brittle. What is brittle? Kind of.
Let me touch mine.
But now for the hyper is fine and thin.
Thinning out.
You get that?
Yes.
Yeah. So you may have no changes in the hypo. Then some very severe form, you may go into a coma. You may lose your consciousness, and that's a very, especially for elderly people, when the thyroid is now completely, that's severe hypothyroidism. In medical, you call it myxedema coma, and you can go to ICU, and we need to pump you with hormones so that you wake up. So it can lead, because now your body has shut down. Remember, your heart is beating slowly. Your systems are shutting down because you're no longer being. So again, for females, you have irregularity of your menstruation. Some women, you may lose your pregnancy because of a hypothyroid disease can cause you to lose your pregnancy. So if I talked about women during pregnancy. When a woman is pregnant, they have a thyroid disease. The child may get affected.
So will they end up having the thyroid disease themselves, the child?
Sometimes, because let's say the woman is not having enough iodine, and the child depends on the mother to give iodine. So the child can be born with iodine deficiency. And for children, it can be quite severe when they have that, because iodine in children is and the thyroid hormone is very important for the brain development. So the children can be born with mental retardation. I'm not a pediatrician, but I'm just mentioning how important it is to think about the thyroid disease in pregnancy.
Speeding. Take this end of the show.
We on?
Yeah, we're on.
Clearly, Daktari, by the look of things, it seems like we are not able to finish everything in just one episode.
Yeah,
wow. So you guys, you have to watch out for part 2, because there is so much more that we need to learn about thyroid disorders, how to just know when it is lingering on somewhere, and how and when to actually seek for medical help. So thank you, Daktari, and I'm sure in our part 2 we will be talking about so much more, including how to diagnose it.
Thank you.
Thank you.